Welcome students. Myself Adshaya GR, lecturer of Emmanuel Arasar College of Pharmacy. Today we are going to see about sunscreens. Introduction. Visible sunlight is only a tiny part of whole radiation spectrum emitted by sun 400 to 700 nanometer. By increasing wavelength greater than 700 nanometer, one enter the invisible radiation range is called infrared radiations IRR. By decreasing the wavelength less than 400 nanometer, one enters the ultraviolet radiations domain. Sun rays have both beneficial and harmful effects on human body depend upon the length and frequency of exposure, intensity of light and sensitivity of individuals. These rays stimulate blood circulations in derma, causes the development of vitamin A from provitamins, increases the formation of HB hemoglobin. Moderates exposure of sun rays causes thickening of skin by producing melanin, which ultimately increases body's natural protective mechanisms against sunburns. So, the visible sunlight is a tiny part of radiation spectrum. When the visible sunlight is 400 to 700 nanometer, it is called IR radiation, and when it is lesser than 400 nanometer, it is called ultraviolet radiations. And sun rays have both beneficial and harmful effect of human being based on their length, frequency of exposure, and intensity of light and sensitivity of individuals. So, they stimulate blood circulation in derma and causes development of vitamin A from provitamins, increases the formation of hemoglobin. They also cause thickening of skin by producing melanin, which ultimately increase body's natural protective mechanism against sunburns. Overexposure to sunlight invisible rays can be harmful to human skin. They can be damaged with an intermediate visible effects such as erythema and sunburn, leading to the cell tissue degradation. The damage can also be termed as cumulative effect of prolonged exposure to now increasingly recognized to be possible cause of degenerative changes in skin, such as premature wrinkling and skin cancer. Indeed, of many skin changes, they often identified with anti-aging actually result from the damage to many sun exposure. Natural protection for sunburn by body through increasing thickness of stratum corneum and pigmentation of skin. UV radiations. UVR from both sunlight and artificial sources is subdivided into three sections, namely UVA, UVB and UVC from the longer to shorter wavelengths. UVA 400 to 320 nanometer, UVB 320 to 290 nanometer, UVC less than 290 nanometer. The UVA section is furtherly divided into two sections, UVA1 and UVA2. Longer wavelengths 400 to 340 nanometer is called UVA1, and then shorter wavelengths 340 to 320 nanometer is called UVA2. The longer the wavelengths and higher the number, the deeper the UV penetrates the skin. The shorter wavelength and lower the number generate greater the energy level of the light and causes more damage to do. The amount of UVA reaching the Earth's surface may be considered to 10 to 30 times greater than that of UVB. UVA long wave length. Peak electrogenic activities and it lowers the energy waves. Primary tanning component. Tan needs injury by ROS to the skin DNA, imperfect attempt to perform and prevent the DNA damage. It penetrates deeper from UVB, dermis, tanning and photoaging. Effects of UVA manifests usually after a long duration of exposure, even if it does not the low doses are low. Studies have been shown that UVA impairs an anti-agent property present in the cell of epidermis cell. They causes immune suppression, thus contributing to growth of cancer, skin cancer. UVA induce significant photobiological reactions, mostly of the indirect nature and requiring the presence of oxygen, such as immediate and delayed tanning reactions and new melanin formations. UVB minimum wave. It is the highest and most severe damage. It causes highest and most severe damage. It ranges from 290 to 320 nanometer. It is the primary burning component, sunburn vitamin D synthesis, responsible for inducing skin cancer. Direct impact on the cell DNA and proteins. UVB is the principal cause of acute sunburn and tanning. Therefore, sunscreen efficiency is predominantly directed against UVB radiations. In addition to exposure of UVB radiations in immunosuppressive, mutagenic and carcinogenic activities. UVC, short wavelength, its range from 100 to 290 nanometer. It is observed nearly to by stratospheric ozone. Sunscreen. Sunscreen is also known as sunblock, sun cream and suntan lotion. Is a lotion, spray or gel foam and other topical product that absorbs and reflects some of the sun's ultraviolet radiation and thus help against sunburn. So sunscreen's others name are sunblock, sun cream, suntan lotion, and it is in the form of lotion, spray, gel, foam and other topical absorbent. It is used to prevent sunburn by reflecting sun's ultraviolet radiations. Principle: protective layer can be provided to skin that prevents UV rays to reach the skin. Example, zinc oxide, incorporation of substances that filter sun rays by observing UV range 280 to 320 nanometer but allow higher range to pass. Substances to prevent symptoms of inflammation without reducing the tanning of damage of cells liberates histamine in tissues which can be treated as antihistamines. Substances as 8-methoxypuracil can be taken before exposure to sun, which accelerates tanning but avoids sunburn. Sunburn preparations. Sunburn and suntan preparations are classified into three types. Palliative preparations, stimulative preparations, sunscreen preparations. First one is palliative preparations. It is used for relief of irritation, other problems caused by sunburns. It is used to relieve the irritations and other problems caused by sunburn. Stimulative preparation. They are the artificial suntan preparation which is a great demand in Western countries. Stimulative preparation is a great demand in Western countries. It is an artificial suntan preparation. Sunscreen preparation and aprodal agents. Sunscreen preparation is most and important of all preparations. It should scatter incident light effectively and should absorb the portion of sun radiant energy. Opaque powder such as zinc oxide is most effective as it will scatter and reflect the UVs falling upon it. It is also known as physical mechanism PBA, and these textures which absorb UV radiations. Ideally, sunscreen agents are should be non-toxic and stable. Absorbs range over 280 to 320 nanometer. Should be neutral and readily soluble in suitable vehicle. Ideal sunscreen. Typical sunscreen should contain the following components: a combination of physical and chemical agents, broad spectrum, cosmetically elegant, substantive, non-irritant, hypoallergenic, non-cosmogenic, and economical. These are the following things you have to prevent whenever we have to use in making sunscreen. Sunscreen preparations. First one, soluble type. It can be prepared simply by mixing and dissolving sunscreen agents and other ingredients in suitable vehicle. Cream type. It is an emulsion type taken by oil phase and aqueous phase, separated and heated to liquefy, then mixed with the string. Gel type. It is highly viscous preparation. It is the thickening agent separates dispersed in water and mixed together with the other ingredients. Lotion type. It can be solution or extra type preparation where solution is prepared by mixing the sun protection factor is a measure of fraction of sunburn producing UV radiations that reach to the skin. For example, SPF 15 means 1 by 15 of burning radiation will reach the skin, assuming sunscreen is applied evenly in thickness milligram. The SPF can be measured by applying sunscreen to the skin of volunteer and measuring how long it takes to before the sunburn occurs when exposed to artificial sunlight source. Organic sunscreens, UVB fillers, PABA derivatives, cinnamides, silicates. Organic substances, UVA fillers, benzophenanes, oxybenzone, silicobenzone, avobenzone, miradimate. Inorganic physical sunscreens, zinc oxide, titanium dioxide, others iron oxides, petrolactam, kaolin, calamide, ichtamol, talc. Inorganic agents functioning the reflection, scattering of UV radiation. Opaque. Their opaque nature is whitening effect and inherent disadvantages which may be minimized by the use of micronized and ultrafine particles. Sunscreen protection factor. SPF measure the sunscreen protection from UVB rays. This kind causes sunburn and contributes to skin cancer. SPF does not measure how the sunscreen will protect from UVA rays, which also damaging and dangerous. Sun protection factor Minimum dose of radiation of photoprotect skin to minimum dose of radiation of unprotected skin. Factors which influence effectiveness of sunscreen. Difference in skin types, thickness of applied sunscreen, time of the day, altitude, environment, and vehicles. Thank you.